So we talk about harm reduction a lot, but what is it? Harm reduction is a movement for social justice that's built on the belief in and respect for the rights of people who use drugs. So that's the overarching theory, but how does that actually come into play? Oh, pardon me? Oh, okay, I'll keep going. So what it looks like, it's a set of practical strategies and ideas that are aimed at reducing the negative consequences associated with an individual's drug use. And there's three different kind of branches for how that manifests itself. There's the first approach, which is managed use, and we'll talk about that, what that is, safer use, and then abstinence. And each one of these are valued strategies, and each one is taken into consideration for where that person is at. So it's on a spectrum. Really what harm reduction helps do is it helps reduce stigma and judgment for the individual that is experiencing a substance use disorder. It is embracing that individual within a larger community context and a coordinated system of care. And it moves to elicit any form of positive change for that person. So when we're looking at any positive change, it's any circumstance where their harms associated with drug use are lessened. So that could be someone who has a long-term history of using IV drug use that shares needles. Well, they're now going to a syringe service program and they're now accessing clean needles and reduced risk for transmitting diseases. They might be using condoms for other types of behavior. They might be choosing to smoke instead of using IV drug use. Anything that would help have that positive change for that person. So there's quite a few different examples of harm reduction. This slide and the next slide are going to talk about some of those examples, but harm reduction isn't limited to what we're going to talk about. But these are a few of the different examples. So the first one is needle distribution, and that includes the distribution of sterile syringes and supplies, and that helps reduce the harms associated with IV drug use. That could be endocarditis, a bacterial infection, that could be wound care and kit control, that could be just the overdose risk potential associated with IV drug use in general, and that could also be the transmission of bloodborne pathogen diseases. Another example when we're talking about managed use is distributing condoms. So we're addressing that this minimizes the harms associated with unprotected sex, and that includes STI, HIV transmission, or unwanted pregnancy. And it also includes access to Naloxone to counter opioid overdose. We're going to talk a little bit about what Naloxone is, but that's a major component of it as well. And then managed alcohol programs. So that's taken into consideration that we know that folks drive, but how can, or drink, excuse me, but how can they appropriately and safely consume alcohol in a way that is respective of their community? So there's really strong PSAs that we see all the time, especially around the Super Bowl, which is coming up, making sure not to drink and drive, assigning a designated driver, or a harm reduction approach sometimes that they have at bars is those individual breathalyzer kits that you can purchase. Another example is methadone maintenance programs or medication-assisted treatment. And that's for opioid use disorder that utilizes medications to help reduce those withdrawal symptoms and cravings associated with opioid use. And that can help stabilize an individual and reducing the harms associated with their opioid use and behaviors. And then peer support, which is a huge one. That's a harm reductionist approach because peer support specialists can meet folks where they're at and at a continuum of their use or their recovery journey. So those are some of the examples that are from a broader harm reduction approach, but these are some examples of things that are being employed in our community. So safer drug use practices includes fentanyl test strips, and that's what this example is down here at the very bottom. Fentanyl test strips are what I like to think of as being like a pregnancy test. It doesn't tell you how far along you are, it tells you yes or no whether or not there's fentanyl in the product that you just tested. So if it's 2 stripes, it shows that it's no. 1 stripe indicates that yes, there is fentanyl, and that can be used for any substance that an individual purchases and wants to see. So that could be methamphetamine or it could be heroin, whatever that looks like. And that provides informed consent for that person so they can modify their behavior to take into account that fentanyl, which is highly potent, is in their substance that they're using. Another option is never use alone hotline. One of the first principles of safer use harm reduction approaches is encouraging people not to use alone because that's when there's an increased overdose potential. So this never use alone hotline is really awesome. It's a national hotline that folks can call. They provide their first name, their location, and the number that they're calling from. An operator can stay on the phone with them while they use, or they can call them back. And then if that person is no longer responding, they'll call local law enforcement or first responders for them to let them know that somebody is unresponsive and needs to be at the scene for medical intervention. And that's helped save so many people from overdose. Another aspect is syringe access and disposal. So when we look at disposal, that's reducing sharps litter. That's making sure that we're utilizing our waste disposal services appropriately and potentially reducing inappropriate needle sticks. So this example right down here, this little tiny red bin, that is an example of a home sharps container that is available through the Idaho Harm Reduction Project. And they give that out to anybody who requests or might need one. And that is really important for people who use drugs, but also folks that have medications that need to be administered through a intramuscular syringe, or somebody who uses IV methods of administration for medications like diabetics. And then they utilize this container, and then when that is full or when they're ready to, they can dispose that at a sharps container, like a larger standing sharps container. And this is one that was recently installed off of Americana here in Boise. Another example of harm reduction is housing first. So housing first is the way of recognizing that when individuals have safe and stable housing, they are more likely to be able to receive that coordinated care and support that they need to be able to address chronic mental health issues, substance use disorders, and being able to enable them to address poverty and other types of social determinants of health. So this is New Path Housing Project, which is Idaho's first Housing First project. And they provide a whole spectrum of different services throughout our community and have been highly successful with data that I can share with you if you're interested in reducing the harms associated with chronic homelessness and substance use and mental health conditions. And it also includes referrals to treatment. So it's acknowledging that folks need a spectrum of different types of care and services, and treatment can include a lot of different things. So these are all the principles, right? These are the general practices and ways that harm reduction can be applied to a community, but this is an example of what this could look like. So this is a general example of a clinic. This individual here is being able to access vaccines for diseases like hepatitis A and B. They also have testing services for HIV and hepatitis. And then here in this next room, you've got counseling on treatment and prevention of HIV, hepatitis B and C, and then PrEP. And then they can also provide referrals to substance use treatment services, medical care, primary care services, behavioral health and mental health services, and other support services. And that can include social services like housing, food pantries, legal aid, identification, documentation, things like that. And then out here, you've got someone who's able to access to and safe disposal of sterile supplies and injection equipment. So these are all the things that harm reduction by examples and kind of the overarching principles of what it entails. But here's what harm reduction isn't. Harm reduction is not anything goes. It's not enabling use, it's not condoning use or encouraging use, and it's not excluding abstinence-based treatment as a viable option. So it's identifying that those three different strategies are able to support an individual for where they're at, and it's taking away judgment from what we think that person needs or what society might think that person needs, and reinforcing the value of that individual to be able to make their own executive decisions regarding their welfare and use, and looking for any form of positive change based on that person, where they're at in their care. So the principles of harm reduction is really reinforcing health and dignity. It establishes that quality of an individual and community life and well-being, and that's not necessarily including the cessation of a substance. But that it's saying that, hey, the criteria for a successful intervention and policy is where that person is. And it's participant-centered. So it's saying it's non-judgmental, it's not coercive, and it provides support and services to anybody regardless of where they live and what they would like to have out of treatment. And participant involvement. It ensures that those that are drug users and those with a history of drug use, they routinely have a voice in the creation of programs and policies designed to serve them. So there's a whole phrase, nothing about us without us, and that's really important. So we need to have those voices when we're looking at interventions in our community. And participant self-rule, it's having that autonomy for service recipients, and making sure that the solutions are based on their own personal choice, and it affirms their right to be able to utilize drugs if they choose to do so, but it's supporting them in a ways that it reduces the harms and helps support their larger community. And it's recognizing the realities of poverty, class, racism, social isolation, generational and past trauma, sex-based discrimination, and other social inequalities that that affect both people's vulnerability to and capacity for effectively dealing with drug-related harms. So it's that recognition of inequalities and injustice. Excuse me for the spelling error. And practical and realistic. For better or worse, people use drugs. That is a part of our world, and it chooses to, and working in harm reduction helps minimize its harmful effects rather than ignoring them or condemning them. But it's meeting those folks where they're at. So why does it matter? It's the big part. Why am I here? Harm reduction provides tools and education to individuals that engage in substance use and other high-risk behaviors. That helps reduce stigma, it increases the trust and communication and engagement of an individual, and it helps improve their individual health as well as the community's health. And it can reduce disease prevalence and control the spread of sexually transmitted diseases and bloodborne pathogens like HIV, AIDS, hepatitis, bacterial infections associated with IV drug use like endocarditis and cellulitis. And it also provides condoms to those folks so that if they do engage in high-risk sexual activity, it can reduce the prevalence of STDs as well. And it reduces fatal overdoses. As individuals that have education on overdose risk factors, they can modify their behavior accordingly because they're being provided that education. And they know how to recognize and respond to an overdose, which is critical because most often it's other folks that use substances or their family members and friends that are responding to an overdose before law enforcement or paramedics. And that includes the access to an administration of naloxone. And it helps reduce syringe litter. That happens. If people don't have an avenue of being able to dispose of their sharps appropriately, they'll put it in public containers, they'll put it in waste baskets, they'll put it in public bathrooms or trash cans. And the alternative, because we know that this is going to happen, is that people can use personal or larger commercial sharps disposal bins. And then that helps reduce those accidental needle sticks, especially in those 3 high-risk categories, which is healthcare workers, law enforcement workers, and waste management service workers. So harm reduction includes all these different things that you can see on your screen, but it's based on science and it's based on what we call the trans-theoretical model. And that identifies that people go through stages of change. And when a person wants to engage in any type of harm reduction approach or strategy, they can move in and out of those stages of change at any given time. So the stages of change are, for those of you that might not be familiar with it, there's 6 different stages, and relapses can be a part of that for some folks. Pre-contemplation is when people are living actively in harm's way. They're not thinking about change. They've not rejected change. They're just not really at that point of thinking about strategies. And then contemplation, they're thinking about it, they're talking about it, they might be seeking out support or education, and they might be tired of living in harm's way. And then planning is what it would take to make that change happen. So they're actively looking at strategies and thinking of how they can implement them. And that's strategizing of how they can move out of harm's way, whatever that harm might be. And then action, where they're actively taking those steps to be able to put their plan into practice, and they're gradually moving out of harm's way. And then maintenance, when they've achieved that positive and concrete development with continuing and potentially little support, and they're living and long-term out of harm's way. So relapse is falling back into those old patterns of behavior. That might be for somebody, they've engaged in sexual activity without a condom. They might not be wearing a seatbelt. They might be drinking and driving. They might be sharing needles, any one of those different aspects of harm reduction. And each relapse is met with new insights and experience that can help inform that person and also re-engage them back into those stages of change based on the motivation that they experienced. So these are any type of health-related behavior, and acknowledges that this is where people are and this is how they live, and this is how we can help support them by going through them with that continuum of change. So harm reduction is evidence-based. I think it's really important to talk about data when we talk about these public health policies and these larger interventions, because we are removed from science. Science precedes our personal belief systems and ideologies, and it helps reinforce the value of harm reduction approach strategies and behaviors. So when there was 2 cities that were compared, one of them had a sharps disposal service. They had an SSP, a sterile supply program, and the other didn't. The one that had that SSP, they had 86% fewer syringes in places like parks and sidewalks and public restrooms. They compared 2 different neighborhoods in Baltimore, and one of them had an SSP and the other did not. And the one that had the SSP had 11% decrease in crime in their community. And also, really importantly, individuals who use SSPs are 3 times more likely to stop injecting and 5 times more likely to enter into treatment. And it helps prevent up to 50% a decline in HIV and hepatitis C incidence with individuals that engage in SSP services. And when combined with medication-assisted treatment, HIV and hepatitis transmission is reduced by more than 75%. Just want those facts right there. Just let that marinate with you. That's phenomenal success outcomes. So this is what harm reduction is as a general principle, and this is how it's evidence-based. But Naloxone that we're going to be talking about is also evidence-based. So when overdose education and naloxone distribution, this is the strategy that Central District Health does. That is what we call an OEND type of approach, and that has reduced across the board in the United States, reduced overdose death rates in studies or in locations where that was implemented. And that can be, depending on the study, 80 to 90% of reversals that were carried out by bystanders. So that's family members, friends, community members, or other folks that use drugs. And when done with law enforcement, it has shown in communities where law enforcement is actively carrying naloxone and knows how to use it and encouraging the use in their communities, that it helps increase survival rate in their communities for overdose and reduce those overdose deaths. And increased naloxone access does not increase any type of drug use within a community because it's already present. It's helping protect and reverse those overdoses for those when they do occur. So naloxone is supported by pretty much everybody. Look at all these major names on your screen. We've got the CDC, got the NIDA, SAMHSA, FDA, and the US Surgeon General. And everyone across the board has said that targeted naloxone education and naloxone distribution, especially in high-risk areas like treatment centers and criminal justice settings, are really important, and that naloxone is a life-saving tool that can help reverse an overdose. And it's one of the 5 major strategies through SAMHSA to prevent those overdose deaths, including the community-wide distribution and use of naloxone. So naloxone, talk about some people sometimes, and if you're not familiar with it, I'll talk about it here really fast. So naloxone is a tool for overdose prevention, and that includes being a tool of harm reduction. It's a medication that can temporarily reverse an opioid overdose, and this is kind of how it works. So naloxone blocks the brain's opioid receptors, which allow breathing to be restored. When someone has engaged in opioid use, they bind to the receptors that are on the brain. Everyone has them. An overdose occurs when there's too many opioids that have attached to those receptors, and that can slow or stop breathing in the case of a fatal overdose. Naloxone comes in and it dislodges the opioid off of the receptors, and it takes the place of that opioid on the receptor. And that allows that person to be able to start breathing again and reverse some of the fatal signs and symptoms of an overdose. And naloxone comes into 2 forms. It comes in an intramuscular injection that is used by needle and syringe, and then it also comes in a Narcan nasal spray. And we coordinate the distribution of both of these with our community partners. Naloxone only reverses opioid-related overdoses, so prescription opioids, heroin, or illicitly manufactured fentanyl. But as we know, we're seeing a saturation of synthetic opioids in our community supply. So fentanyl isn't everywhere, is in every substance. So we're seeing that in methamphetamine. We're seeing Oxycontin tablets being pressed to look like they're pill form, but they're actually compressed fentanyl. And so it's important to have naloxone available regardless of the form of substance that an individual uses, because it could be cut with an opioid. And it's only effective for 30 to 60 minutes, depending on that person. So after that time period, a person can resume overdosing. Naloxone doesn't eat the opioid that is floating around in that person's brain. It's just dislodging it off of those receptors. So after that time period, it's really critical that individuals have access to emergency medical services and support. So who should carry it? You. Anywhere that people live, work, and play, naloxone needs to be available. For the high-risk categories, that's people who have risk factors for overdose, and there's a lot of overdose risk factors. And anyone who uses illicit opioids or could be around someone who uses illicit opioids or could be around someone who's experiencing an opioid overdose. And that's most people that work in healthcare. That's people who work in mental health, behavioral health, substance use treatment services, customer service, faith-based communities, and a lot of different sectors. So when we have that widespread access to naloxone, we can respond to an overdose if and when it should occur. And you can get naloxone through Idaho Medicaid. It's available for free. For anybody who has Medicaid benefits, they can go directly to their pharmacy and their pharmacist can write them that script for them. Or you can also access it through a statewide initiative called the Idaho Harm Reduction Project. And they can also support individuals and organizations to have naloxone on site and teach you on how to use it. And folks can call or they can text to be able to order that naloxone, or they have an online order form. So it's really minimizing those barriers of being able to access this life-saving medication. And they can pick up if they're here in the Boise area or Treasure Valley area, or they can also have that shipped anywhere throughout the state of Idaho. And then the last option is Nexlox Zone. And we talk about the Idaho Harm Reduction Project. In addition to other community resources, there are interactive service maps that help provide that last stage of harm reduction, which is referrals to treatment for whatever type of treatment that individuals prefer. And that includes getting testing or accessing recovery-based supports. So that is that. I think I beat my timeline as expected. So harm reduction